Hello and welcome. Polio, a potentially killer disease mostly affecting children, is on the rise, and nearly all the cases found are among Muslims. The World Health Organization says the opportunity to fully eradicate polio through vaccination does exist and sees it as a test case on whether or not the world can come together in a coordinated manner to eliminate such diseases. Well, throughout history, there have been 6 attempts to fully eradicate diseases, and the only success was with smallpox. In the case of polio, the most vulnerable are children under the age of 3, who account for half of the victims claimed by the highly infectious virus. The disease, which is spread through poor hygiene, attacks the nervous system and can result in total paralysis and death. Anyone can be affected, but it's now been discovered that more than 90% of the cases found, as I've mentioned, are among Muslims. The majority of cases are in North Africa, but polio is also found in India, Pakistan and Afghanistan. While there's no cure for polio, it can be prevented through immunization. Well, joining me for the debate on this is Elisha Rennie, a professor of anthropology at the University of Michigan, from where she joins us. Professor Rennie has studied the polio eradication programs in northern Nigeria. On the phone from Kano in Nigeria is Garba Abdu, a senior program manager of USAID. He's been working on child survival projects in Africa for more than 10 years. And here in the studio with me in New York is Bruce Aylward, who's the coordinator of the World Health Organization's polio eradication program. I'd like to welcome you all to the show, and Bruce, start with you if I may. The number of people affected by polio seems to be small compared with other diseases such as malaria, for example, or AIDS. Why do you think that the fight against polio represents such an important test case when it comes to disease eradication?
Well, actually, though there's very few cases of new polio these days, Riz, there's actually 10 to 20 million people. We don't actually know how many living with the disease every single day right now. And the reason that eradication provides such a wonderful opportunity to serve as a test case for what we can do is in international health and cooperation on development is because there's no way to fake the results. With eradication, it's all or nothing. You are either successful, you truly reach the majority of the children around the world's population, and deliver this very, very basic service, or you don't. It's a real, it's a very, very visible, stark and concrete example.
I just spent some time with the United Nations at an effort to try to improve water and sanitation as part of the Millennium Development Goals, and one of the messages that came out of that is that water and sanitation has a knock-on effect with all other aspects of human development, and health is one of the key issues. And I wonder, with the eradication of polio, how much it would help to have issues such as water and sanitation brought in, or is it just in your case, or in your view, a case of immunization?
Well, if we had excellent water and sanitation in these places where polio persists today, it would be a massive advantage in terms of getting the job finished. If you look here in this country, in the United States and other countries in Western Europe, a lot of the big drop that they saw in polio years ago was because of improvements of sanitation, even before they had the vaccine. So now, when we're trying to eradicate the disease, we're asking this vaccine to make up not only for the immunity in these children, but also for the problems in their environment with the sanitation, etc. We're asking a lot of this vaccine.
I mentioned something at the beginning when I was introducing the show that the majority of cases, 90%, among Muslims, the cases being found. Why?
Because I think the right way to look at this is the places where the disease is persisting is where we have large Muslim populations. But it's persisting not because the people are Muslim, but because there is poor sanitation in these areas or low routine immunization coverage and very large populations in relatively small areas, densely packed areas. And as a result, that's the ideal circumstances, ideal setting for a disease like this to persist. So in northern Nigeria, in Pakistan, and then because of the security situation in Afghanistan, and also in the northern part of India, all those factors come together, and there are Muslim populations living in those areas. It's not that Muslims are against vaccination or against eradication. In fact, the real leaders, one of the real leaders early in the eradication initiative was the Middle East, which went very, very quickly.
Well, let me bring in Elisha Rennie here, who's joining us from Michigan, and glad to have you with us. Professor, you've studied the eradication initiatives in northern Nigeria, in which most of the cases, which has the most cases of anywhere. And I wonder, what is the cultural and political context that's allowed the disease to spread so much there?
Yes, well, it has to do with the Muslim population in the area where I work is in northern Nigeria, Zaria, and they feel suspicious of the government. The government at the time when the main main eradication efforts were in place, the government was seen as not helping them. So that they were wondering, why are they bringing in this vaccine when other problems in the public health sector, such as malaria and measles, help for them in those areas was not available.
Now, are you confident, based on what you've seen and the studies you've conducted, that polio can be brought under control? What happened in 2006 was really very important and encouraging, because they brought in a program where they were giving people other health incentives, and even recently they're going to, I believe, have a measles eradication or measles vaccination day throughout the North, and that will really help people to feel that, you know, there's a government concern with all of their health issues, not just polio. It was the focus on polio alone that made people a little bit suspicious. Let me bring in Garba Abdu here from Kano in Nigeria. It's good to have you with us, Garba. And I want to ask you, you know, that was the area where you are, where the boycott of the polio vaccinations took place in 2003 and 2004. Explain to us why that boycott happened. I know it's an expansion on what Professor Rennie has been talking about, but let me know if those conditions that prevailed that made people boycott the vaccinations have been overcome at all.
Well, sorry, the issue of 2003 in Nigeria, you know, came about because of a lot of rumor, mostly misinformation, that generated a lot of tension in the country. Subsequently, the government of Nigeria set up several committees to verify the quality of the vaccines and the safety of the vaccines, and then later on confirmed to be safe. And then, particularly from Kano State, immunization was allowed to proceed. And we made a lot of progress thereafter, up to 2006. 2007 was particularly excellent, except that 2008, things start to degenerate. And the virus starts to transmit all over the states, all over Kano and all over the 8 high-risk states in northern Nigeria.
Garba, if I can put an email to you that we got in, that came in from Harfia in London, in the UK. And Harfia says, why don't Nigerians produce their own vaccine so that they can know what's in it? And shouldn't polio vaccination be compulsory for those requesting a visa from Mecca? Now, those going on the Hajj, the Muslim Hajj, the pilgrimage to Mecca, I think now are required to produce a vaccination certificate anyway. But I wonder why, if there is a fear about where the vaccine is coming from, or whether it's authentic, or whether it's safe, why doesn't the Nigerian government produce its own, according to our viewer?
Well, I'm sure it's a common knowledge that producing a vaccine is not an easy business or activity, and also for a developing country, Nigeria, it's a huge task to embark on. After all, we're hoping that polio should be eradicated very soon. So the quality of the virus is now no longer primarily the issue. What the issues? Quality of the immunization program, supplemental immunization program that have been conducted, and still we are still missing a lot of children, and still our routine immunization is still very, very low. And so, you know, we are working at it. We have had a couple of ERCs, that is expert review committees, and we have strong recommendations from people like Bruce and many others. And what Nigeria is doing has actually moved forward, set up a special task force to deal with the polio issue.
Okay.
And the states are working towards having a similar task force and dedicating a lot of time, effort, and energy to resolve the polio crisis. Okay,
let me get Bruce Aylward back in here and ask an email question on this issue of trust, and some of it's been touched on by Garba with the previous question. But Paula Varley in Norfolk in the UK sent an email saying, governments are the only organisations who can achieve trust in vaccine safety. If people don't trust them, multinational NGOs like the Red Crescent could help build that trust and administer the programme. How much is that a case that you can bring in outside organisations such as the Red Crescent to help build that trust in a place like that?
Well, I think that can be part of the solution, but for example, with our own children, we're going to trust the people who we know, who we trust on other issues. And if our leaders, our traditional leaders, our religious leaders, our other leaders look at an issue carefully and believe this is the right thing, then we will listen to them. So I think as important as it is to bring in outsiders, perhaps to provide the scientific basis or to explain wherever or clarify whatever issues might be confusing a point, I think the critical thing is to build trust among the leaders of those communities so that they in turn can translate it as necessary into the local context.
Okay, I'm going to get some more questions to all of you, but just please stay with us. We're going to take a short break. Back with more on the debate on the fight to eradicate polio after this.